Welcome back to the deep dive.
Good to be here.
Today, we're tackling a subject that, well, might make some folks a little squeamish, maybe.
Uh-huh. Canine vaginal discharge.
Exactly. But trust us, if you share your life with a dog, this is incredibly relevant stuff.
It really is. It's one of those things you see and your mind immediately jumps to, okay, is this normal? Or, is this really serious?
Right. And the answer could be either or somewhere in between.
Yeah, absolutely. It's actually a surprisingly common reason people bring their dogs to the vet.
So we've got this great stack of sources, articles, veterinary notes, really digging into this.
Yeah, they cover the whole spectrum, all the potential causes, how vets figure out what's actually going on, and the treatment options.
And our mission for this deep dive is basically to unpack all that for you.
Help you understand what's what, recognize those signs that need immediate attention, and just appreciate the kind of detective work vets have to do.
Think of it as getting the inside scoop, being well informed about something common, but potentially quite serious.
Let's jump in.
Okay, so you see discharge, first thought. Is this okay?
And our sources are clear. Sometimes, yeah, it absolutely is normal.
But the classic example is related to the heat cycle, right?
Yeah.
Estrus.
Exactly. During prodestrus and estrus, you'll often see a kind of bloody or maybe pinkish discharge. That's just, well, it's part of the normal cycle. The body's preparing.
Okay, and what about after having puppies?
Ah, yes. Post-whelping discharge. It's called lochia.
Lochia. Okay.
Yeah. It can look greenish-black, maybe reddish-brown. It's just the uterus cleaning itself out after the puppies are born.
Yeah.
It should gradually lessen over, several weeks.
So if it's tied to those specific things, heat cycle, recently had puppies, it's often just normal physiology.
Pretty much. But then there's the whole other category of abnormal discharge.
And this is where it gets complicated, isn't it?
Oh, yeah. The sources really lay out the complexity here. The list of potential problems is, well, it's long. Everything from infections to structural issues, even things that aren't starting in the vagina itself.
That's the real challenge, I guess. It looks like one thing, but the cause could be minor, or it could be a genuine emergency.
Exactly. Speaking of emergencies, Pyometra.
Yeah, that's the word that always comes up. Strikes fear into dog owners.
And for good reason. It's a severe, often life-threatening uterine infection. The uterus literally fills with pus. The sources really stress how critical this is.
And there are two types.
Right. Open pyometra, the cervix is open, so the pus drains out. You'd see that as discharge, often pretty foul-smelling.
Okay, so visible discharge.
Yes. But then there's closed pyometra, cervix is shut tight.
So no discharge.
Oh, visible discharge, no.
Yeah.
The pus is trapped inside. The uterus can swell massively, might even rupture. That type is often much harder to spot early and can be even more dangerous because the signs might be less obvious initially.
Wow. Okay, so seeing discharge isn't always pyometra, but not seeing discharge doesn't rule it out either. That's crucial.
It really is a critical distinction. Now, beyond pyo, you've got more straightforward infections just in the vagina itself. Vaginitis, very common.
Just inflammation or infection right there in the vaginal canal.
Yeah. Bacteria, yeast.
Mm.
Could be either. The discharge might look mucoid, cloudy, maybe yellow-green like pus, sometimes even bloody, and often it has a strong, unpleasant smell.
And the sources mention different types, juvenile versus adult.
Right. Juvenile vaginitis happens in puppies before their first heat cycle. Often that actually revolves on its own or with simple cleaning. But adult vaginitis, that usually signals something else is going on, an underlying cause.
Like what sort of underlying cause?
Could be things like, well, anatomical abnormalities or problems starting higher up, maybe even the urinary tract.
Okay, let's unpack the anatomy bit. What kind of issues are we talking about?
Structural things, quirks, like a vaginal stricture that's a narrowing or a band of tissue inside the canal.
And that traps things.
Exactly. Traps discharge, maybe even urine, and makes it way easier for infections to get started and just keep coming back.
Or I think I read about a recessed vulva, where it's kind of tucked in.
Precisely. Tucked deep within skin folds. That creates this warm, moist environment, Bacteria just love it. Leads to chronic irritations, skin fold dermatitis, and vaginitis.
Makes sense. What about growths?
Yeah, tumors or polyps inside the vagina. That's another cause that the sources bring up.
And they could bleed, causing a bloody discharge.
They certainly can. And they can be different types. There's even one called transmissible venereal tumor, TVT. It's actually contagious between dogs through mating.
What?
Yeah. Thankfully less common now in many places, and sometimes, though rare, urethral prolapse, where the urine tube protrudes, can look like a red mass near the vulva and cause bleeding that might be mistaken for vaginal discharge.
Okay, this brings up a really important point. How does the vet even tell if the discharge is really from the vagina, or maybe somewhere else nearby, like the urinary tract?
That is the absolute core of the diagnostic puzzle. The sources really hammer this home. Discharge that looks vaginal could actually be starting way higher up, like Pyometra or metritis, which is a uterine infection after birth. Or it could be those anatomical issues, or yeah, even the urinary tract.
Ah, so a UTI, a urinary tract infection, could actually look like vaginal discharge.
It potentially can, yes. If there's a bad infection or lots of inflammation down there in the lower urinary tract, it might present with discharge near the vulva, or even just urinary incontinence, leaking urine that can irritate everything externally, cause inflammation, lead to secondary discharge, or just be mistaken for discharge itself.
Man, that really shows how tricky this can be. It's not always straightforward just looking from the outside.
Not at all. And the sources mention other less common things too, like foreign objects stuck in there, or even systemic bleeding disorders causing vaginal bleeding.
Right. So given this incredibly wide range of possibilities from completely normal to get to the vet right now, how does a veterinarian actually figure out which problem they're dealing with?
This is where the real detective work kicks in, isn't it? The sources emphasize a really thorough step-by-step approach.
Starts with the history, I assume, when you tell the vet.
Absolutely. The vet needs all the details. Your dog's age, breed, is she spayed or intact, when was her last heat cycle, ever had puppies, and then, crucially, everything about the discharge itself.
Like when it started, what color?
Exactly. When did it start? Color. Consistency. Is it thin, thick, like pus? Is there an odor? How much is there? Every little detail is a clue.
Fine.
And they'll also ask about other symptoms. Is she acting sick, lethargic, offer food, drinking tons of water, running a fever, any changes in how she urinates?
Got it. Then comes the physical exam itself.
Yep. A full checkup, general health, feeling the abdomen gently, any pain. Does the uterus feel enlarged? Checking temperature, lymph nodes.
And a close look at the actual area.
Oh, definitely. A careful look at the vulva. Is it red, swollen, painful? Is it recessed, like we talked about? Then, if the dog tolerates it and it seems necessary, a vaginal examination.
How do they actually do that? Look inside.
Well, in little dogs or puppies, it might just be getting a really good look visually. For larger dogs, they might use a special scope, it's called a vaginoscope, to actually see inside the vaginal canal. Look at the walls, check for those strictures, any foreign objects, masses, inflammation. Sometimes they can do a digital exam too, with a gloved finger.
Okay, so history, physical exam. Then lab tests must be pretty important. The sources really highlight those.
They are absolutely critical, essential for pinpointing the cause, especially telling infections apart or finding those underlying issues. A really core test is vaginal cytology.
Cytology, that's looking at the cells from the discharge under a microscope.
Exactly that. Take a swab of the discharge, put it on a slide, stain it, and look at what kinds of cells are there. Seeing lots and lots of neutrophils, those are inflammatory white blood cells, is a huge red flag for infection or inflammation.
What else might they see?
Different types of epithelial cells lining the vagina, maybe yeast, bacteria, red blood cells, potentially even cancer cells in some cases.
Now, this is where the sources made a really interesting point.
Yeah.
It's not just about finding bacteria, is it? It's more nuanced.
No, and this is such a crucial takeaway. You might think, okay, just run a bacterial culture, see what grows, see what antibiotic kills it. And yes, you often do need a culture and sensitivity test.
Okay.
But, and the sources really stress this, you always need to do the cytology at the same time as the culture to interpret the culture results properly.
Why is that so important?
Because the dog's vagina isn't sterile. It's got its own little ecosystem, a microbiome full of different bacteria. Some are totally normal residents. Others are what we call opportunistic, like E. coli or mycoplasma. They can be found even in perfectly healthy dogs sometimes. A culture by itself might just grow some of that normal background stuff.
Ah, okay. So the cytology tells you if those bacteria are actually causing a problem. Like, if you see inflammation, those neutrophils on the cytology slide, and you grow a significant amount of a potentially bad bacteria on the culture, then you've got strong evidence it's a real infection.
Precisely. You nailed it. If you grow bacteria, but the cytology looks totally normal, no inflammation, those bacteria might just be innocent bystanders, part of the normal flora.
That's fascinating. So it's about context,
Yeah.
seeing if the body is actually mounting an immune response.
Exactly. It's not just find the bug. It's, is this bug causing disease here?
Yeah.
Really important distinction.
So much more complex than just swab and test.
Absolutely. Other key lab tests, urinalysis and a urine culture are vital to rule out or confirm a UTI as the source.
Makes sense.
And blood work, a CBC complete blood count and a chemistry panel, especially if the dog seems systemically sick. A really high white blood cell count is a classic sign of pyometra, for example.
And they mentioned testing for brucellosis specifically.
Yes, particularly important for intact dogs, especially those used for breeding. Brucellosis is this nasty bacterial infection, affects the reproductive system, causes discharge, infertility, abortions.
I think it can spread to people.
That's the other major concern. Yes, it's zoonotic, so definitely something to rule out in the right context.
What about looking inside with imaging, ultrasound, x-rays?
Definitely needed if you suspect something's wrong with the uterus or other internal structures. Abdominal ultrasound is really highlighted as the go-to imaging tool here.
What makes ultrasound so useful?
It's just fantastic for looking at soft tissues. It can show really clearly if the uterus is enlarged, and crucially, if it's full of fluid or pus essential for diagnosing pyometra. It can also help check for pregnancy or find uterine masses.
And x-rays.
X-rays, or radiographs, can show if the uterus is severely enlarged, but they're not as good as ultrasound for seeing what's inside it, not as detailed for fluid or pus.
The sources also mention contrast studies sometimes.
Yeah, things like vaginograms or cystograms, they inject a special dye, and it helps outline structures on an X-ray. Good for visualizing things like those vaginal strictures or problems in the urinary tract, or maybe an abnormal connection, like a fistula, between tracts. Sometimes you need biopsies of masses, too, or a procedure called cystocentesis to get a clean urine sample directly from the bladder.
Okay, so it really is a multi-step investigation. History, the exam itself, cytology working with culture, blood work, urine tests, imaging. All designed to narrow down that big list of possibilities.
Exactly. It's a systematic process to get to the specific problem because, as the sources make crystal clear, the treatment depends completely, 100%, on what the diagnosis actually is.
And if it turns out it is normal, like heat cycle discharge or that lochia after birth,
then usually just basic hygiene, keeping the area clean is all that's needed.
okay. What about vaginitis, the inflammation?
Well, if it's mild, or that juvenile type in puppies, it might just resolve on its own. If it's a confirmed bacterial or yeast infection, and you see that inflammation on cytology, then you need targeted treatment. Antibiotics or antifungals, usually guided by the culture results.
But you have to fix the underlying issue, too.
Absolutely. If there is an underlying cause like that recessed vulva or a stricture, you have to address that often surgically, or the infection is just going to keep coming back.
Right. And for the big one, pyometra.
That's where things get urgent, and usually surgical. The definitive treatment, the gold standard, is removing the infected uterus and ovaries. A full spay, an ovariohysterectomy.
Even if the dog was already spayed. Oh, wait, spaying prevents it, right?
Spaying prevents pyometra, yes, because you remove the uterus and ovaries. But if an intact dog gets pyometra, the treatment is that emergency spay surgery. The sources are really clear. This is a medical emergency, and surgery is the way to go.
They did mention trying medical management sometimes for open pyometry.
They do, but it's complex and risky. Usually only considered in very specific situations, like for a really valuable breeding dog where preserving fertility is paramount. It involves drugs like prostaglandins to try and make the uterus contract and expel the pus, plus intensive antibiotics and very close monitoring.
Doesn't sound ideal.
It's not. It's risky, it doesn't always work, and even if it does, the pyometra can easily happen again later. Surgery is overwhelmingly the safer and more definitive recommendation.
Okay. What about uterine infections after birth? Metritis.
That often involves antibiotics, sometimes flushing the uterus, supportive care for the mum. Severe cases might end up needing surgery, too.
And growths, like tumors or polyps.
Usually surgical removal is the first step. Then they send the tissue off to a lab histopathology to figure out exactly what it is, benign or malignant cancer, that TVT, the contagious one. Interestingly, that often responds really well to chemotherapy or sometimes radiation, rather than just surgery.
And fixing those anatomical issues, recessed vulva, strictures.
Those typically need surgery to correct the anatomy, create a healthier environment down there, and stop the recurrent problems.
And brucellosis. That sounded tough.
It is particularly challenging. Treatment involves long courses of antibiotics, but it's often very difficult, maybe impossible, to truly cure it. And because of that risk to humans, euthanasia is sometimes recommended, especially in kennels or breeding situations, to prevent spread.
Wow. Okay. So wrapping this all up, what does this mean for you, the listener, the dog owner?
I think it means that while seeing some discharge isn't automatically a five-alarm fire, understanding the potential causes is just so important. If that discharge looks abnormal, the color, the smell, the amount, or if your dog is acting sick in any way,
Lethargic, drinking more off food.
exactly, any of those signs, a vet visit is absolutely non-negotiable. Things like pyometra are true emergencies where getting help fast makes all the difference.
And just knowing the huge range of possibilities, normal cycles, critical infections like pyel, structural things, even urinary issues masquerading as vaginal discharge,
Yeah.
it helps you be a better advocate for your dog, right? You can give the vet much better information to start their investigation.
Absolutely. And understanding that diagnostic process, why the history matters, why cytology and culture together are key for infections, the power of ultrasound, it helps you appreciate the complex puzzle your vet is putting together to get to the right diagnosis and the right treatment, which could literally be life-saving.
It's quite something. When you consider everything we've unpacked from these sources, how the vagina isn't sterile, it has this whole community of microbes,
Right, the microbiome.
and how just finding bacteria doesn't automatically mean infection without seeing the body's reaction on cytology,
Mm-hmm.
and how discharge can even be a bit of a trickster coming from the urinary tract. It really makes you appreciate the detailed, sort of multi-layered approach vets have to take. It highlights that managing infections, especially in these complex areas, it's just not always as simple, here's a pill fix, is it?
Not at all. It's a great reminder that veterinary medicine often requires some real deep investigation to find the actual root cause, especially for a sign like discharge that can point in so many different directions.
Definitely something to think about.
Yeah.
Thanks for joining us for this deep dive.